live workshop with Kennington Osteopaths. I'm Jake Alsop. I'm an associate osteopath at Kennington. And I'm going to start putting on these videos, hopefully weekly, on Wednesday evenings, just to take you through some common injuries, some common aches and pains, and how to manage them well at home. I'm going to go through, basically I'll go through some information about each thing I'm talking about. We'll do a bit of anatomy really quickly, using Ernest properly, and I'll go over some advice and some exercises you can do at home, essentially. They're going to be good to try. If you're in real pain and you're really struggling, I'm going to suggest you actually get in touch directly so you can get a personalised rehabilitation program going. But if you're just struggling with a little bit of pain here and there, you have a bit of shin splints or a bit of whatever else we're talking about, then just following the advice should really help, and having a go at the exercises should do the trick. I'll go through that sort of active treatment, which is rehab, and then afterwards I'll go through passive treatment. Passive treatment is essentially what I would do, me or any other colleague of mine would do in clinic, so like manual treatment. Obviously we can't do that right now, so I'll give you a few tips on how to do a bit of that at home as well. So shin splints is it's a syndrome. It's called medial tibial stress syndrome. It is. I'll show you on the skeleton here. I can actually take his leg off. There you go. So this is the right foot. So I'll put it next to mine here. Now it actually is. It's when you have pain on the inside of your tibia. So this big bone here. So you have your fibula and your tibia, and it's actually pain on the inside of this bone here. Now it is a syndrome, and it's an umbrella term for quite a lot of issues. So you can have like posterior shin splints, you can have lateral shin splints, but in the literature, what's researched is the medial tibial stress syndrome. If you do have pain elsewhere, give all this stuff a shot anyway, because it's likely going to help. It may not directly help it, 100%, but it is going to help anyway. Now it's called medial stress syndrome because it is on this medial side of the tibia. And it's a really common issue in athletes. It's the most common cause of lower leg pain in athletes. And researchers found it happens in about 20% of runners. And I found that it's happened a lot during the start of lockdown because a lot of people have been smashing the runs basically in the park as their form of exercise. And you might be a gym goer. I've had a lot of CrossFitters with it. You might also already be a runner, but have picked it up quite a lot, and you start to get that shin splint feeling. It's multifactorial. The cause of it. It's often caused by training errors, biomechanical abnormalities, so the ways your body's moving. With that in mind, other predisposing factors are old injuries. So ankle sprains on one side, changing the load going through the leg. Knee niggles, hip niggles, lower back issues, changing how you run. It's essentially going to change how the force goes through the bone. So it is a bone issue, and that's why it can be such a pain to get rid of. It's not like a muscle strain where you can just leave it for a week or two, and then get back to your training. It's actually inflammation of the periosteum, so that's the coating of the bone. For that reason, rest is often the best way. Plus rehab after you've rested it, and I'll get onto that in a second. So yeah, it's a repetitive strain, repetitive load going through here, and it causes strange bending and strange forces going through the tibia. So when that gets inflamed, it gets really upset. So to help it, you need to change how you're running. First off, have a look at your shoes. Sometimes people come in and they're running crazy amounts, they're really fit, and their shoes are like 3 years old and they're falling apart. Have a look at your running shoes. Are they up to date? Are they a good pair? turn them over, have a look at the soles. You can actually see where they're worn down if they're like, an old pair. And you might have a good idea if on one foot you're running differently to the other foot. They should be symmetrical where you have the wearing of the sole of the foot. I haven't got any shoes up here actually. And if they're not, then that gives you a good idea. You might be running a bit wonky. Some other issues. Sorry, I was about to say how it feels is important as well to determine what you've got going on. So with shin splints, it's a diffuse pain. So you have this general pain around here. You can't really put your finger on it usually. If you can do that, if you can put your finger on a part of your bone and tap it and it's painful, you might be running the risk of having a fracture, a stress fracture. It's a really small little fracture in the bone. So if you're having that, maybe go and get it checked out by a GP or by a therapist, okay? But with shin splints, it's that diffuse pain around the shins. It will come on with exercise. Sometimes it actually, as you warm up, when you get into it, it sometimes gets better, but other times it will just maintain. It will be bad after exercise, and it can be painful on rest as well. If you're female, you have increased risk. If you run more than 20 miles a week, you have increased risk. And it's often associated with like these muscular imbalances or inflexibility through the calf muscles. So we're going to be looking how to change that as well. So initially, with the acute phase, I'm going to talk you through like acute and subacute phases. With the acute phase, that's when it first gets sore. That's when it's going to be really inflamed and painful. What you're going to want to do is rest and ice. Essentially, rest and ice is the main thing you can do for shin splints. Remember, it's just the bone that's inflamed. So we need to just get that inflammation down. So take the load off the bone. Take the load off the muscles as well, because there's going to be some muscular involvement. And ice it. You can ice it 5 minutes on and off. And do it for about 20 minutes. And you need relative rest. So if it's bad and you're feeling it when you're running up the stairs or walking down the hill, if it's bad, you're really going to have to just lay off the running for 2 to 6 weeks. And that's a hard pill to swallow sometimes, especially if you're mid-season. Not running for that long can really hinder, what you're doing. But it is relative rest. You may want to just do nothing for a few days or just leave exercise for a week or two, or at least running. And then you can start to get back within that 2 to 6 week window. You can start to get back training, but basically train differently. Don't do running. Get on a cross trainer instead. Get on a bike. Do some swimming. Just don't do that repetitive load, because that's just going to flare it back up. You're going to find that if you can, some of my patients have left running completely for a month, and they've come back to running, and it's come back on straight away. And that's so demotivating. So what you want to do is do this relative rest, but in that time, ice at loads, and then get on with the rehab, which I'll get onto pretty sharpish. When you get back to running, you want to make sure you're reducing everything. So one researcher, I can't remember who it was, but they found that basically a good way to get back into it is to half everything you're doing. So 50% intensity, 50% distance. So essentially just tune everything down and really slowly increase it. Don't increase it more than 10% per week. I'd actually, for shin splints, do less than that. It's a long process. But like I said, during this time, you can be smashing the cross trainer on the bike to keep your cardiovascular fitness up. So slowly increase the load onto the leg over the 6 week period. And you're going to find that even though you can maybe do the run afterwards, it's most likely going to flare up a bit. So when it does flare up, whack on the ice and leave the ice on for 20 minutes, okay? All right. So then the rehab. When you've done the acute phase, you've got it down a little bit, it's a little bit painful, and you're starting to get training again. So the rehab you want to do in the meantime is going to be really important to start reloading the shin and to start strengthening some of the muscles that need to be strengthened. For some of you, it might seem a bit mundane to start the rehab. What I'm going through, because you might already have that strength there, but I'm go through it anyway. Okay. Alright, so to get started, if you're training in the gym or outside, obviously wear shoes. If you're at home, you don't need to wear shoes for these. It's really good to actually get used to using your feet and get all your foot muscles working. Hence why I'm just wearing, nothing. We're just going to start with calf raises, really simply. These might be sore if you're really acute, or if you're feeling a bit better, you might not feel this much at all, in which case you can start to make them harder and harder. I'm going to show you the easiest way first. So simply, firstly, you're just going to do double leg calf raises, okay? And you can do these on a flat surface. And then essentially you want to increase that load after a while. So to make it harder, you do a couple of things. You can either hold a weight. I'm just using this stick to balance, sorry. I'm going to use my foam roller, but you can maybe grab a weight, grab a dumbbell on your chest, or grab a backpack and just make it heavier, okay? So add that load. Now you can get quite heavy with this. So if you're in a gym setting, do start to really train that strength. If it's not causing too much pain, then make it really, really heavy. What you want to do then is also do that one side as well. Okay, so the one leg. When you're doing this at home, even if you're proficient to do one leg, still warm up doing double leg. You want to do high rep, mostly everything we're doing here. We do high reps, so you're looking at 15 to 20 reps, and you're going to do it 2 to 3 times, okay? If you're getting too fatigued, or if you're starting to get too much pain, then you can stop and you can adjust your rep scheme. So you're doing straight leg and bent leg. Two feet and 1 foot. And you're going to do it with straight knees and bent knees. So when we bend our knees, we're focusing on a slightly deeper muscle, deep into here, called the soleus. And that's a massive muscle involvement in shin splints, okay? So do your 30 reps, your 20 reps times 2, like this, and then do exactly the same thing with bent knees, okay? And then with one leg, but bent. Another way to do the bent way, which I quite like, is essentially going into a full squat. Hang off something, so I'm just going to hang off my bed. And I'm going to go up and down, okay? Try to keep yourself leaning backwards. So if I were to let go, I would just fall backwards. If you do 15 of these, I promise you your calves will be burning. That's fine, just stop and shake them out. So after you've done that, one of the ways to increase that as well is to make it into a deficit. So essentially you can just stand off a step. I have actually got nothing here. But you would stand off, like I'm going to stand off my foam roller here, and you can start doing your raises, okay? So you can see my heel is going past the 90 degrees, so you get a really big stretch through the calf. So start just strengthening those posterior tissues, okay? Once you've done that, you want to go into the anterior compartment of your leg. So what we've just done is the back muscles. Now we're going to look at a specific muscle at the front. It's called tibialis anterior. I don't know if you can see it on here, maybe with the shadows, but if I just raise my toes up towards the ceiling, you can see this muscle poking out here. That is tibialis anterior, okay? We need to make sure that that's strengthened as well, and you've got a good muscular balance between the front and the back, okay? So to do that, you are going to need something to step on. I'm going to grab a book. So I'm going to use my massive pathophysiology book that I use for university. You can just use a book or use a step. And you're essentially going to lift your toes up to the ceiling. So my toes are hanging off. Okay, my heels are on, my toes are hanging off. I'm just going to lift them up to the ceiling and then just pause for a good moment, okay? And again, you can do one leg. That will probably get quite hard quite fast. I I wouldn't think you need to add any more weight to this. This is pretty much a body weight exercise that you can do. And same with the calf raises. You're going to do straight leg and bent leg if you can, okay? It's not going to change the muscle length too much, but it's just going to change the angle at which your ankle is working. So essentially with this, again, a high rep scheme, you may find it different to the calves because there's not as much muscle there. But just do it until it starts to burn. Rest it, stretch it out a bit, shake it out a bit, and then do it again, okay? Until you get a burn. You'll probably find you can't do half as many. That's absolutely fine. And then you're going to get on to the next bit, which is heel and toe walking. Now this is a massive one. If anyone's ever been to a physio or osteopath before with shin splints, you most likely would have been given this exercise. And you're essentially going to be tiptoeing or heeling across the floor. So I'm just going to take this mat away because it's a bit too spongy. Ernest is in the way. There we go. Sorry, mate. So you should be able to see my feet here. I'm going to walk, on my heels. So my toes are lifted up off the ground, okay? Up off the ground. And you're going to walk about 2 or 3 meters one way and back. So I'm just going to walk towards you. Use your hands as balance. And you're waddling like a penguin. That's fine. Forward, and then keep your balance and walk backwards. Okay? Keep your legs straight. Forward and backwards, okay? Maybe go forward and backwards 2 or 3 times, 2 or 3 meters, or however long it takes for your calves to start burning out. Even just doing that little bit there, my shins started burning a little bit. So you go again, rest it, have some time off. You're going to want to do this quite a bit, okay? So maybe do 3 sets of this. And then, tiptoe walking, same thing. Straight legs. Forward and backwards, 2 or 3 meters. Doing it until you feel the activation, until you feel it's taking effect. Once it's taken effect, don't push it too far. Never push past the sort of 4 out of 10 pain. If you're going more than 4 out of 10, I want you to just rest. And that's probably you for the day, okay? Until you get more used to it. With the tiptoe walking, we can also do that with bent knees, okay? Sorry. So with the tiptoe walking, you do bent knees as well. Walking forward and backwards, okay? Again, that's going to start to engage that deeper muscle, that's the soleus. Alright? So I'm only going this far now. You don't really need to go into a squat, alright? You just need to bend knees a little bit, okay? Walking forward and backwards. And then again, obviously, that heel walking. You probably won't be able to do the bent heel walking, it's fine. By this point, especially if you're suffering with shin splints, you might even want to stop there, okay? You might be done for the day. You're going to feel quite swollen. It's going to feel pumps like you've had a workout. You have had a workout. You can just leave it, do some stretches, which we'll come to in a second. And then if you need to, ice it again, 15-20 minutes, okay? Quick note on the ice, hopefully you already know this. Don't put ice straight on your skin. Wrap it up in a tea towel, yeah, just so you don't get that ice burn. So there's a few other muscles that we need to start training. Coming down the side, wrapping around the inside of your ankle, and coming down the lateral part of your leg, okay, wrapping inside the outside of your ankle. A couple of muscles through here, we need to start just getting engaged. I'm going to do them individually first. I'm just going to set my bed, I think. Here we go. You need to get yourself a band for this. If you haven't got one, just pop on Amazon or nip down to a clinic when they're open and just buy them. They usually sell them. We do at Kennington. Make a little hole, pop it around your foot, okay? I'm going to do 2 directions. First direction is going this internal deviation, okay? So my band's pulling my foot down, or it's pulling it outside, alright? And I'm just pulling it back up to the ceiling. That's going to start to train the inside of your foot. Sorry, the inside of your leg. For strength of the band, it's going to be quite individual to you. Get something, again, where after 15 reps, it's getting a bit sore. Then, head out to the other side. So I'm going to stand on it here. The heel would be on the ground. I don't think you can quite see my heel. There we go. And I'm pulling it in. So now, instead of pulling it to the out, it's pulling it inwards, all right? And I'm just going the opposite way. So now you're training the outside of your leg. You know, if you're in that sort of final stage of shin splints where it's just niggling you a little bit every time you run, but otherwise you're good, really start loading this quite a lot. Get a lot of load through here to make the band quite strong. And again, similar rep scheme to everything else I've given you today. High rep, 15 to 20. Do it 2 or 3 times or whatever your body allows you to do, okay? That's once you've done all that and you start to get a bit better, we need to actually get you back into running. So it's that repetitive force. So we're going to bring in some plyometrics to the picture now. Essentially, you're just going to start to do hopping, all right? Hopping on the spot, single leg. Hopping with 1 foot as well. It's a good idea to maybe throw in some skipping, okay? Of course, if you're doing skipping or hopping, do the rehab first, warm up your leg, and then go into the skipping, okay? Otherwise, you just get shin splints again. So start light, only do it for 30 seconds, build it up over time. And you're doing double leg and single leg, okay? Then you can go into sort of things, then you can go into deceleration exercises. So when you're running, especially if you're sprinting, a lot of the single leg work you do, well, when you're running, you're running on 1 leg the whole time. You're always just on 1 foot. You're never actually on 2 feet. So we need to train your body in that 1 foot position. So jumping up with both and landing on one. And that's going to start to create a bit of deceleration through the muscle. And it's going to hopefully increase your stability as well. So there's a proprioceptive component to this as well. So you're just going to jump up with 2 feet and land with 1, okay? Land in that sort of half squat. Make sure I don't hit my head. So up and 1. Try to keep the balance. That was not very good by me there. Okay. I think it'll be better to do like 5 on 1 leg and then 5 on the other leg. All right. Try to keep that balance. So you can see I'm actually quite poor on my left side. There we go. So you want to be able to get stable and reset rather than just falling down each time. Once you get good at that and it's not causing too much pain, just turn it into hops. Okay? Again, forward and backwards. And just see how that feels. You may suddenly doing the movement, it may flare it up a bit. If it is flaring it up a little bit, that's fine. If it's more than 4 out of 10, then, you know, give it another week until you start the hopping. And then finally, one more thing you can do is spins with the hop. Doing 90-degree turns on 1 foot. What this does is, when you're spinning round, you have to basically stop your body from spinning. So the deceleration causes a lot of the muscles on the outside of your leg to train. So if you're going to the right, on your right leg, you're doing all these lateral muscles, and if you jump to the left, you start training the inside here. So they're all the exercises for you to do for rehab. And it's learning how to apply. Sorry, I'm out of breath. It's learning how to apply those exercises. You know, if you're struggling, or you're not sure how to do them, or they're causing too much pain, do get in touch. But otherwise, crack on and just slowly increase that load. 4 out of 10 pain is fine. Anything more, and it's too much. If it hurts the next day, 4 out of 10 pain for the next day is okay. Just ice it and rest. Wait for that pain to go down, crack on that second day with the rehab again. You want to be doing this every day. And unfortunately, if you've come up with, you know, shin splints over the past couple of weeks, you are just going to have to stop the running outside. Sorry. If you have a bike, get a bike. If you have a Boris bike, you know, Santander bikes, use them. But bad news really. But the good news is you have loads of information to get cracking on with, and you can actually be really productive. In between rehab, you might want to just do a little bit of self-treatment. For me, probably a mixture of just hands-on massage and trigger ball or foam roller. It can be quite useful. So I have a couple of tools I use. Foam roller, trigger ball. So it's like a little cross ball, it's like a really hard tennis ball. Or a peanut roller, which is essentially this, but connected into two. And you can just use all three. Find out which ones you like best. Rolling your calf out. You're using your foot and your hands as anchors, as stabilising. When you put more pressure on, cross your legs over. That's going to start to get a bit tasty. Oop. If you want to punish yourself a bit more, get your peanut roller. Do the same thing. Start to get the different heads of that muscle. And that's going to be a bit sore, okay? And you can use this as well to get in with your hand into parts of your muscle. Do the same on the front, on that tibialis anterior. Again, how to find it? Dorsiflex your foot up, so toes to the ceiling. You'll feel that shin muscle pop out. It'll be on the outside of your leg, okay? Get a foam roller, get a trigger ball, get a peanut, or get a foam roller, whatever you want. You can do it handheld, or you can do it off the floor as well. And just do it to a modest pain threshold. Don't go too high, okay? There's a really good myofascial release you can do on the tib anterior, so that shin muscle. And all you're going to do is cross your leg over. You're going to dorsiflex and plantarflex your foot, so up and down. And as you're doing it, you're going to get two fingers on that muscle. So you can see it popping up and down. I'm going to just hold on to it. So my two fingers here, bang, on it there. I'm going to put some pressure on and move it up and down. And I'm going to work down that muscle. Do about 5 in one spot. Come down a bit. 5 in another spot. So there, for me, I can feel that going all the way to the top of my foot. That's absolutely fine. Just do it to your own threshold, okay? Remember, 4 out of 10 pain is fine. And just work down. You can do it on the outside as well a little bit, okay? So that's quite a nice myofascial release for you to try. Obviously just massage. Put your foot up on something. Get a bit of, you probably won't have massage lotion. Get a bit of moisturiser or extra virgin olive oil, something nice. And just start massaging up. Always go towards the heart. Start to separate the muscles out a little bit. And just try to calm it down slightly. When you're self-treating, especially if you're doing something that feels painful, sometimes you get that feeling where it's painful but it's kind of nice. If you're having that, fine, but don't fall into the trap of sitting there for like 20 minutes watching TV and doing it, because you will wake up the next day and you won't be able to walk. You're going to over-treat yourself. So if you're doing that, just treat yourself for 5 minutes, okay? Get a change, do a bit of massage to calm it down, and that should be enough. That, I think, is everything. Rest, ice, rehab, and a bit of self-massage if you want. Getting treatment in clinic, it's really valuable. Everything I've shown you today is very focal, so we've only looked at the local musculature and the local inflammation. Like I said, it's caused by that repetitive loading, that change in that rapid increase of training. But often there's other factors such as ankle and foot mechanics, the back mechanics. I've had someone once before come in with Shin Splints, and he had a car crash and he had a couple of fractures in his ribs. And because of that, everything was drawn in. So I'm going to exaggerate, but he was basically standing and running with his body over to one side. And that completely changed how he ran and how he put his weight onto one foot. And then that foot, was taking so much weight because of his ribs that he started to get shin splints. And his rehab wasn't working. Hence why he came to me. If the therapist had looked up into his ribs and released off the ribs and the lats like I did, then it would have been successful. So, there's little factors like that you have to consider. If you're doing all this rehab and it's not really working, then, get in touch. We'll just get a consultation done so you can get back training. But otherwise, if it's a little niggle, give all this a go and you should find that it helps. Okay? That's everything. Thanks for tuning in. Is there any questions regarding what we've discussed today? Just pop them in the comments section and I'll try to answer you now. I'll just give you a few more minutes. And if not, just, log off. No, you all good? Fine. Great. So I hope that helps. Send me a DM if you think of anything afterwards. Either direct message Kennington Osteopath or just get in touch with me, Jake Alsop, Osteopath. That's my Instagram tag. Otherwise, good luck with the Shin Splints. And hopefully you can get back to training ASAP. Just don't rush it too fast, otherwise you're going to be stuck in a loop. Okay? Thank you very much for coming in. Hopefully this was a successful first workshop Wednesday. I'll be back next Wednesday at the same time. I think what I'll cover is lower back pain. I think. I've not actually decided. I probably will do lower back pain because essentially a lot of people have got it as well, because now everyone's just sat at home and not really doing much. They all start to get this change in posture. So if you're having some low back pain, tune in next week at 6 p.m. and I'll give you some tips for that as well. Otherwise, have a good evening and thanks for joining. Adios.